Smiling depression. Smiling depression, also known as masked depression or covert depression, is a psychological condition in which a person is able to hide their depressive symptoms behind a facade of happiness and optimism. While people with smiling depression may appear normal, or even successful and happy, internally they experience deep feelings of sadness, anxiety, and despair. Symptoms of smiling depression. Discrepancy between external behavior and internal feelings. The person appears to be smiling and happy on the outside while internally experiencing sadness and despair. Constant stress and feeling overwhelmed, feeling constantly emotionally or physically exhausted as a result of trying to maintain this mask. Feeling isolated, even if the person is surrounded by friends and family, they may feel isolated or disconnected from others because they are unable to express their true feelings. Excessive anxiety, worry about the future or daily stresses can be very present. Changes in sleep or appetite. As with traditional depression, the person may experience sleep disturbances, insomnia or excessive sleeping, or changes in appetite, increase or decrease. Causes of smiling depression. Social pressure. Many people feel pressure from society to act a certain way, especially at work or in front of friends and family. This pressure can lead them to hide their true feelings in order to maintain an image of happiness or strongness. Stigma. Some people feel ashamed to admit that they are depressed, either because they fear social judgment or because they feel weak. So, they choose to pretend that everything is fine. Personal and professional responsibilities. People who have high responsibilities, whether at work or in their family, may feel that they do not have the right to show their weakness or that they fear that doing so will negatively impact those they depend on. Perfectionism. Individuals who have very high standards for themselves may fear failure or appearing weak, so they hide their depression behind a mask of perfectionism. How to support people with smiling depression. Be aware and vigilant. If you suspect someone is suffering from smiling depression, be alert for small signs such as excessive stress or comments that may indicate hidden negative feelings. Paying attention to small changes in their behavior may help reveal their true feelings. Encourage open communication. Encourage the person to talk about their feelings in a non-judgmental way. You may need to reassure them that you are there to support them. Offer practical help. Offering to help with everyday matters can have a big impact. A person with smiling depression may feel overwhelmed by their responsibilities, and offering to help can relieve this pressure. Encourage them to seek professional help. It is important to encourage the person to seek professional psychological treatment. Sometimes, offering advice about talking to a professional or even accompanying the person to their first appointment can be very helpful. Patience and understanding. It is important to be patient and understanding. People with smiling depression may find it difficult to open up, but your continued support can be key to starting the healing process. Consequences if smiling depression is not treated. Escalation of symptoms. If smiling depression is not treated, the symptoms may worsen over time, which may lead to a psychological or physical breakdown. Increasing isolation. The person may begin to feel increasingly isolated, even when surrounded by others, which increases the severity of the depression. Suicide risk. Unfortunately, people with smiling depression may be more susceptible to suicidal thoughts because they do not express their feelings and do not get the support they need. Conclusion. Smiling depression is a complex psychological condition that requires a deep understanding by those around the sufferer, as well as courage and awareness from the sufferer himself to admit that he needs help. By raising awareness of this type of depression and providing appropriate support, these people can be helped to break out of the cycle of concealment and reach a healthier and more stable psychological state.